Okay. Wow, really good to be here. I don't actually need to share like the first half of what I was going to share because Terry already told you. But so yeah, my name is Dr. Russ Morfitt, and the work that I do is treatment of anxiety problems. And there are a lot of anxiety problems out there, and I'm really privileged to be able to spend my time helping people who suffer with problems ranging from social anxiety to general anxiety to maybe you've heard of obsessive compulsive disorder. Some people have panic attacks. There's a problem called panic disorder, post-traumatic stress disorder. Those are the sorts of things that I do, and I do it two different places. I wonder if I'm going to be able to operate this thing here. Okay. So yeah, so I do it two different places. One is just right across the street over at Hutchinson Health. And I've been privileged to be there for something like 16 years, and along the way, then I've been able to develop my skills to focus on treatment of anxiety, and it's been really a privilege to be there. But the new thing that I'm doing, apart from Hutchinson Health, is to help people really around the world by the new website that we created called Learn to Live. And it's just extremely exciting to me. Really the problem being most people who suffer from social anxiety related problems never ask for help. They just never ask for help. So all the people who I never see in my practice, because they never ask for help, we're able to help because it's a lot easier to start off by going to a website than actually, working up the courage and figuring out how to do what it takes to actually meet with a provider. And if you're not somebody who's dealt with this personally, if you can imagine what it's like. So for example, I'll ask you a general question. How many of you would say, I think I know the difference between a psychologist and a psychiatrist? If you feel like, yeah, I confidently know that. Okay, just a handful of people. So if I'm somebody who's suffering from social anxiety or another kind of anxiety problem, and I think, okay, I'm fed up with this. I really want to get some help now. But where do I even start? Phone book? What do I do? All these barriers and hurdles to really asking for help. That's why I'm doing Learn to Live. But really I'm here to talk about big picture, how social anxiety affects people at college. So let's talk about an example. So let's say Marie. Marie's a second-year-old student who's a second-year student studying biology. She's 19 years old. She's from good old Hutch, and she's in some of your classes. Marie's a hypothetical person, but you don't notice her. She kind of slips into class quietly. She slips out of class quietly. Lectures and labs, there she is, there she's gone. You hardly notice her. At one point, you say hi to her, and she doesn't say hi back. And so you think, well, how stuck up is she? But maybe not. Maybe not. Maybe it's not an issue of being stuck up. Luke, he's a first-year student studying generals. He signed up for several classes. He mysteriously withdraws from Intro to Communications. He withdraws from General Chemistry. He's still in another class or two, but if you notice him at all, you notice he's just always with that one guy who he rides to campus with. And if you are also from I didn't say where Luke is from Litchfield, you might have noticed, hey, that was the same kid that Luke always spent time with in Litchfield as well. Maybe Luke and that friend are just really good friends, or maybe there's more to it than that. Peyton's a PSEO student. She blends into the woodwork. You hardly notice her. takes the Trailblazer over, and then she, right after class, she finds her way back to the bus. When she drives, she finds her way back to the car right away after class. Where'd she go? In the hallway, it's occurred to you to maybe say hi to her because she's in a class or two of yours, but she's always on the phone for some reason. Then after 3 weeks, she disappears. These are some examples of people who, hypothetical people, who suffer from social anxiety. And as I say social anxiety, I'm talking about problem social anxiety. And we'll get to the idea that social anxiety itself is not an unusual thing, that social anxiety is actually a very normal and useful thing. But when I'm talking about social anxiety, I'm talking about serious problematic social anxiety. So what happens when people suffer from anxiety disorders like social anxiety and some of those others that I mentioned at the beginning that I treat? Studies of students who have left school, who've left college and gone back and said, hey, time out, stop. What contributed to you leaving college? 64% said they had a mental health related concern. They were depressed, they were anxious, they had another problem, mental health related concern that contributed to them leaving college. So they're not here. Here we are in the middle of the term, but they're gone. These are issues that really do affect college students. With Learn to Live, we do a lot of work with Facebook and Twitter. And so we found this was tweeted to us on Twitter. Hearing people laugh near you, not talking because you're afraid that what you say will be judged. Keeping quiet in a conversation with 3 people. Not being able to go anywhere alone. Staying inside all day. Hating when the teacher asks you a question in class. Eye contact. Eating in front of people. Counting money before you pay. Not leaving voicemails. Paying for things at a shop. Asking for help. Always preparing for what to say. Bumping into people you know. Feeling embarrassed all the time. That's what we're talking about with social anxiety. People who have problematic social anxiety. This is the kind of story that I hear over and over and over again. It can affect every little area of your life because we're around people so often. 2 numbers, 8% and 12%. 8% is, at any given time, in the general population, 8% of the population is diagnosable with social anxiety disorder, meaning their problem with social anxiety is so great that they are diagnosable with this disorder that because it causes them so much impairment. They're missing out on things in life, or they're suffering so much by experiencing the discomfort when they do go places, when they do things, when they do come to college. 12% experience it, are diagnosable at some point during their lifetime. So, what is that, 1 out of 8? 1 out of 8. So if you know more than 8 people, there's a good chance you know somebody who suffers or will suffer at some point from serious social anxiety in their life. Another tweet. I'm actually not listening to anything. I just really like it when people don't talk to me. How many have suspected that there's somebody who you've encountered, or somebody you know, or somebody you've interacted when you've either walked past them or they seem to be busy, you've wondered, they might be uncomfortable and really might just be covering up some discomfort. They might be just trying to avoid things a little bit. Have you ever suspected that? Okay. So Barbara on our Facebook page, we now have 5,000 Facebook members on our Facebook page, but back in September she said, social anxiety, just another disorder for therapists to get rich curing. Whatever happened to shyness? Well, you'll note that Barbara didn't get any likes with her comment. So two problems with Barbara's comment. One of them was addressed, I thought I had that. Oh yeah, by Anna here, who says, shyness and anxiety are two very, very different things. And unless you have severe anxiety as I do, you're just not going to understand. And that's the life of many people who suffer from anxiety. Whether it's social anxiety or some of the other anxiety disorders that I mentioned earlier. Family members and if someone's lucky enough to have some friends, really have a hard time understanding that. It seems so unnecessary. There's no real threat here. Why are you struggling? I don't get that, the family or friend might say, might feel. But in reality, it's a story of somebody really either suffering or just feeling like they can't do it, whatever it is. That's the one problem with Barbara's comment. The other problem is about therapists getting rich. I don't know if any of you are thinking about becoming a therapist or psychologist or whatever. Anybody? Yeah, therapists don't get rich. So that Barbara's in error there. So treatment for social anxiety disorder. Most people never seek it. For those who do, three main kinds of treatment that a person can encounter for social anxiety or related problems. Number one would be supportive counseling. Number two would be medications. Number three would be cognitive behavioral therapy. That's the kind of work that I do across the street, and that's what we've built into to Learn to Live. And there are some other online programs as well that in different countries mostly where they're using online CBT as well. So those are the three main kinds of treatment. As somebody who's, because I spend my career devoted to helping others, I want to make sure that the kind of work that I do really is helpful. And so I pay close attention to what the research says. Most people who go in and seek counseling, if they go in and seek counseling, whether it's for social anxiety, for other things, but we're talking about social anxiety here, will receive supportive counseling provided by compassionate counselors, therapists who are well trained. Well, what does our research say about how that impacts social anxiety? That to meet with a provider and process your week and get that empathy and support and encouragement doesn't help social anxiety very much. So supportive counseling is less effective. Many people get medications, and our research shows that it's more effective. There are side effects that are problematic for some people, but many people are helped. Cognitive behavioral therapy, whether it's face-to-face, with face-to-face, our research shows, okay, that's more effective. And I'll be defining what cognitive behavioral therapy is because, frankly, if you suffer from social anxiety or if you have somebody you care about who does, I would hope that you would seek out cognitive behavioral therapy for yourself or for them because it's more effective, but it's often unavailable because we have far too few providers who do this kind of work, or online. The reason we do it is, as Terry mentioned, was to make it more available. And our research shows that, lo and behold, it's just as effective as face-to-face therapy. Okay, so what is CBT? What have I been talking about? So CBT is cognitive behavioral therapy. We use a really long name with lots of syllables so we all feel very smart. And but really, the cognitive part relates to the fact that we believe our thoughts affect how we feel. So we want to get the head knowledge for starters. That's the cognitive part of cognitive behavioral therapy. So how do we do that? With education, people learn how to challenge their thoughts as well. I'll get to the details of that. So education. We start off with education about the idea that actually anxiety can be a useful thing, as I mentioned earlier. So how can anxiety be useful? Well, let's say you are that skier. If you're just really laid back, like the stereotypical skier is, but I would suggest that the champion skiers probably aren't as laid back as the stereotype. But if I'm just really laid back, like I have no anxiety at all, how hard am I going to work, really? I mean, the champion skiers, they're in the weight room, and they're running, and they're skiing, and they're working hard, and they're working out, and they're focused, and they're feeling a certain amount of anxiety because it's the competition stiff, and so that anxiety can drive us into to work harder, and anxiety can be a signal to us if that there's danger, and I maybe should be doing something about it. So either it's a little bit of anxiety to tell me, okay, work at this, or anxiety that's higher that says, danger, act, do something. Regarding the first one, how many of you know what the Yerkes-Dodson Law is? Yerkes-Dodson Law? Okay, so I'm a psychologist. Psychology as a profession, or as a field of study, actually has been around about 100 years. Lots of research, thousands and thousands and thousands of studies and ideas that have been generated. But we've only generated one idea that has been so compelling that it's ever been declared a law, and that's the Yerkes-Dodson Law, which is this idea that for any given task that I do, that my performance on that task, so let's think about the skier, my performance on that task is related to how much stress that I feel. Now you might, if the idea were, and stress and anxiety are close cousins. And so if having no anxiety means I'm at my best, then my peak performance would be right here, right? When my stress is really low, hey, my performance would be really high. But in reality, the Yerkes-Dodson Law has found over the years that no, it's like this, that there's something, it's not zero, the level of stress that's going to give me my peak performance. So the skier who experiences a certain amount of stress is going to try harder, and the same with people in any other occupation. Welders are going to do a better job welding if they feel a little bit of pressure. Now, what about social anxiety? Can social anxiety be useful? We have our group here, and this is their intro to lit class, and they're talking about Beowulf, and you think, well, is there conversation? Is her contribution going to be better if she has no anxiety, or if she feels a little bit of anxiety?
If she feels a little bit of anxiety.
Yeah, so if she feels a little bit of anxiety, she's going to put a little bit more effort into it, right? She's going to think. She's probably going to care more about how the other person feels, who she's talking to. She's probably going to want to put a little bit more thought into what's happening. And let's say that our other person on the bottom is interviewing for a job. Well, interviewing for a job can produce a ton of anxiety, right? Who's interviewed for a job before?
Like multiple.
Multiple jobs, yeah. Working your way up, right?
No.
Well, if you think about it, if I'm interviewing for a job, I want to put my best foot forward, right? And so I don't want to be here and have no anxiety, but sometimes it can be really hard. Who thinks you've ever been up here when you're interviewing for the job? Yeah. So sometimes when the anxiety is really hard, it's difficult to think as clearly as you could, and and to think of all those great things about yourself to tell the person who's interviewing you. But she wants to have some level of anxiety. She doesn't, so that she can really be engaged, put effort into it. You would want me to feel somewhat nervous feel some anxiety about talking to you, right? Or else you'd totally get which is okay for me, but so no anxiety, and we don't put forth effort, and we don't want that in life. So here's somebody who's applying for the job at IKEA. Make a chair and take a seat. It's not always easy to apply for the job. Okay, I'm going to pause here. I'm going to look at my watch. We're doing okay. Any questions so far? Any questions so far?
How would you describe the difference between shyness and social?
Oh, really good question. So the question was, how would you describe the difference between shyness and social anxiety?
Actually, that was the question I was going to bring up earlier, is that I struggle with anxiety, and to my knowledge, the difference between shyness and anxiety is such that shyness is a quality you have versus anxiety is something that's debilitating and keeps you from participating fully in life, or keeps you from doing things, or makes it very difficult to do things that you feel you need to do.
That was a great answer. That was a very good answer. Could everybody in the back hear his answer? Yeah. Still so good. Big voice. So yeah, it really is a story of impact on our life. So people who are shy have a temperament usually toward introversion. So if I'm introverted, my batteries get recharged when I'm by myself. And if I'm introverted, plus I'm kind of timid and kind of nervous about meeting people. Not all introverts are nervous about meeting new people. They just want to get the batteries recharged by themselves. But if I am introverted, and I'm also somewhat timid, somewhat nervous about encountering new people, I'm shy. So when I was little, I hung onto mom's leg, when she was talking to somebody at church or a meeting, or whatever, at the store. But yeah, social anxiety, when it gets to the level that we're talking about here, really causes significant suffering, and it prevents me from doing what I want to do. We call that impairment in healthcare. I have impairment. Yes.
Is it emotional or neurological?
So the question was, is social anxiety emotional or neurological? Big question that I'll give a very brief answer to, so short shrift to that answer. My friends, the psychiatrists who are treating people with medications, I'd asked you who knew the difference between a psychiatrist and a psychologist. Well, the short answer is psychiatrists tend to treat with medications, psychologists tend to do evaluations or do therapy and treat with therapy, talk treatments like I do. But my friends who are psychiatrists or other physicians who are prescribing medications, they use a model, and I'm not sure if I'm going to get to this in my slides, I don't recall it, but they view it as being a chemical imbalance. So maybe many of you have heard, well, a person has anxiety, a person has depression because they have a chemical imbalance in their brain. And that's their perspective. My perspective is, well, because I have no chemicals, but our research shows that cognitive behavioral therapy, which I do, is one of our most effective treatments without any chemicals directly involved. We know that if I change my thoughts, as we're starting to talk about here, and I change my behaviors, that my anxiety gets better. So they're treating things biologically. I'm treating things by changing behavior and thoughts, both are impacting the anxiety. So does that tell us what the problem is? I think it really tells us it depends on what lens you're looking through. We know that if we do a brain scan of somebody who has a severe anxiety problem, while they're doing certain activities, sometimes a PET scan or a SPEC scan, we're able to see hot spots in the brain that tend to be active that aren't active in the same way with somebody who doesn't have an anxiety problem. And then if that person is successfully treated with medications, we see changes in that PET scan or SPEC scan. It looks different. Now what if they're treated with therapy? Same thing. The same kind of improvement happens in those scans of the brain. So it's strange, and we don't have really a good answer for your question. Yeah. Yeah. Okay. So, I indicated that the cognitive part of cognitive behavioral therapy is about your thoughts, that the idea that your thoughts produce your feelings. And so, I call this the step model, where we say, you know, wait a second, even though most people would say, my situation causes how I feel. Most people talk that way. You say, you know, oh, I'm really stressed because of that job interview. Well, stressed, emotion, right? And what was my explanation? Job interview, like the situation causes the emotion. To which you might say, well, duh, job interviews cause stress. But let me ask you, what if somebody's thoughts were, you know, that interviewer, I just know they're going to like me. I just really think they are. I saw them in the office before when I dropped off my application, and you know, I just think they're going to like me. Versus if my thought is, I am not going to know what to say. They're going to think I'm so stupid. They're going to think I'm boring. I'm going to freeze up. I'm going to drool. Different thoughts, right? Who thinks that having those different thoughts, one person versus the other, or one set of thoughts versus the other, could impact how comfortable you feel? So this is not rocket science. How comfortable I feel means I'm having different emotions, and all I did was change the thoughts. And so a big part of my job in providing people with CBT is helping them learn to change their thoughts. And along the way, they learn to identify, we inspect thoughts. So we identify the thought that goes in that diamond. And then we say, well, let's take a closer look at that. Now, we call them automatic negative thoughts. We call them automatic thoughts because they're automatic. And we often don't notice them. If I'm angry, so a different emotion, if I'm angry, I might not notice that I'm also thinking, so when somebody cut me off in traffic, I might not notice that I'm thinking, that person thinks they're better than me. They think they can push me around. They don't care how I feel. They're trying to put me down. But I might be thinking those, and that's why I might be, you know, feeling angry at that time. And so to be able to slow it down and say, okay, so what were my thoughts? And maybe it was something like that for the anger. And maybe for that job interview, it's something like those thoughts I was saying. They might think I'm boring. They might think I'm stupid. They might think I'm nervous. They might think I'm nervous. It's really a big one for social anxiety. I don't want you to think I'm nervous. Because if you think I'm nervous, that would be awful. And so, why am I on my cell phone? Why am I grabbing the chair, bracing myself? Why am I slipping out of the room? I want to cover it up. I want to get out of there because right now I feel like I'm in the spotlight. If I have social anxiety, I feel like I'm in the spotlight in front of you. I actually am in the spotlight, kind of, but I mean, if at this moment I'm suffering from a high level of social anxiety, I'm viewing myself as in the spotlight. I'm viewing you as being the audience looking at me, and I'm fully anticipating that you're going to be judgmental, that you're going to be having hostile thoughts toward me, that you're going to be highly critical. On truth. there may be some of you who are kind of highly critical. There may be some of you in this room who might tend to judge people harshly. But not all of you. I have no doubt that there are many people in this room who are really willing to cut a lot of other people's slack and really accepting of other people. And if there are people in this room, if I'm suffering from social anxiety and I'm realizing that, wait a second, I might have been just judged by a judgmental person, I might choose to say, I'm just not going to let that person vote. I'm not going to let that person, in my own mind, I'm not going to let them vote on whether I'm okay or not. I'm getting ahead of myself. So, as we inspect the thoughts, we might identify the ants. So let's say I figure out my thought, and I'm having thoughts like, oh, you're going to think I'm stupid, you're going to think I'm boring, you're going to think I'm a bad psychologist, you're going to think I'm a bad presenter. And then we might say along the way that, okay, well, let's figure out there are certain groups of categories of problems with automatic thoughts. One of them is fortune telling. Well, I just predicted what you might think, so I was fortune telling, right? Mind reading, I was pretty sure I knew what you were thinking about me, and I was pretty sure I knew why you turned to whisper to that person next to you. I was reading your mind. Feeling makes fact. The idea that I feel it so strongly, it's just got to be true. Because I felt it in my gut, so it must be true. Disaster making. That's when I say, you know, if this thing happens, it's not just bad. It's really bad. Like, what if you thought I was nervous? Now you might think that, but there's kind of two things happening in my mind. One is I'm fortune telling that you're going to think this a millisecond from now, right? That you're going to think that about me. And then I'm also thinking of it as something that would be really horrible if it were to come true. Well, wait a second. Two problems there, right? One is you might not think that. And the other thing is, I might be able to say, well, wait a second. I can't please everybody, and it's not practical to care deeply about what everybody thinks, and so maybe it isn't a disaster if you think bad things about me. I'm going to peek at my watch here because I have no idea. We have 12 minutes. Okay. Socratic questioning, that's when there I have this thought, and some of you have probably studied philosophy more than I have, but my understanding is that Socrates, back in the day, didn't just tell people stuff. He taught people how to ask themselves the right questions, or he would ask them questions, and then it was their job to answer the questions, and then in the course of answering the questions, they would gain knowledge. So Socratic questioning is the process where I say, okay, I'm having this thought, so I'm predicting, I'm going to shake, right? Social anxiety, I don't want to shake in front of you. 20% of all alcoholics have social anxiety disorder. 20% of all alcoholics have social anxiety disorder. So what's going on? In part, they're medicating that anxiety. Everybody knows that alcohol is a depressant, which is a problem mood-wise and adjustment-wise. But some people are using it to try to manage their anxiety. It works out very poorly for people who do, because they're much more likely to become addicted, much more likely to have serious problems with it. But it might be that I'm drinking to cover up the shake. Because again, if I care deeply about whether you think that I'm anxious right now, it's really important to me that you don't see me shake. And so I don't want to write a check in front of you. Checks are these paper things that we used to use. Anyway, I don't want to write a check in front of you. I don't want to do other things in front of you that might cause you to see me shake. I might not want to drink from a glass in front of you because you might see my shake. And why am I shaking? Because I'm nervous. And when I'm nervous, my body is preparing for action. And when my muscles are tense, right? And when my muscles are tense, when they're really tense, Let me shake. You've seen the weightlifters in the Olympics. It's not just all smooth, right? They're really shaking, right? So Socratic question is when I ask myself questions about that, but thought. Has this happened before? Because I'm predicting I'm going to shake. Questions like, has it happened to others before? What do logic, science, common sense suggest about whether it's likely? How bad would it be if it happens? And then identify a new thought. What's a thought that's going to work better? So it could be that changing my thoughts and changing my behaviors, in the case of this penguin, changing my behaviors can change my outcomes. We just haven't been flapping them hard enough. Lo and behold, we could have been doing this all along. So one kind of knowledge is the head knowledge, and we've been talking about that. So again, cognitive behavioral therapy, the cognitive part relates to my thoughts. I believe my thoughts produce my emotions. But then and that gives me that kind of head knowledge that I don't need to be afraid of you, maybe. I might think this through and end up concluding, yeah, wait a second. Yeah, I might shake, or you might think I'm boring, or you might think I'm nervous. Well, maybe it's not that bad if you do. And so then maybe in my head I know, I don't really need to be afraid of you. But in my gut I still fear it. How many people have ever been afraid of something that you really knew you didn't need to be afraid of, but you were afraid anyway? Yeah. Okay, so a little confession about my profession is, even though we say, cognitive behavioral therapy is demonstrated to be very effective for social anxiety, often it stops with the head knowledge, but it really shouldn't, and the research shows it shouldn't, that it's important that we get that gut level knowledge. Well, how do we get that? Well, we do behavior experiments where we go out there and we do things and check out what our outcomes are. I go out there, do I shake like I think I will? Maybe I will, maybe I won't, but I want to find out. Sometimes I'm predicting that things will happen, and they don't. I want to reduce my precautions. I know that I have that written in the same size font as everything else, but it should be a giant font. It should be enormous. Reducing precautions. Our recent research is showing us that the most powerful thing that we can do to get past an anxiety problem that we have is to quit being so careful. Now, your parents told you to be careful. They told you that. And in some areas of life, you really should be careful. But if I suffer from anxiety problems, and we're talking about social anxiety, it might be that in that area I'm being too careful. Well, what kind of precautions might I do? Well, it might be that if I do a presentation, if I have to do a talk, I'm going to practice and practice and practice and practice and practice and practice and practice so it's perfect, because there's no chance that you can judge me if every word comes out just right. Or it might be, I'm going to I'll just read word for word here. Word for word. And then I won't forget what I'm going to say, because I might be predicting I'll forget what I was going to say. Well, public speaking is a place where social anxiety happens a lot. How many of you ever felt nervous when you're doing public speaking? Yeah. Yeah. I hear you. I hear you. And so public speaking, for example, we might do precautions like reading word for word, over preparing. I might stare up the wall so I don't have to look at you. And I might go really fast to really get it over with because it's really uncomfortable to talk in front of you, so I just want to get this done. And yet, if I reduce at the end, let's say it goes okay. Let's say it goes okay and I survive this semester at school. But I know that all the way I was walking through the hallways, faking phone calls and getting in and out of class really fast. I could draw two conclusions. My conclusion could be, well, what do you know? It really isn't that threatening of a situation. And I'm really up to the task. I didn't have any reason to be afraid. Or I could conclude, that was one near miss after another. Good thing I did all those precautions. I'm going to keep that phone handy. I'm going to get a second phone. And so job one is to really reduce these precautions. So, if if the ceiling caves in before I finish my last 5 minutes here, whatever we have, and all you got from this was for a person to reduce their social anxiety over time, the most powerful thing they can do is to be less careful. That would be the message I want you to take home. And then the other thing we do is fear-facing, where I put myself in situations that are uncomfortable deliberately. Deliberately. The idea is that anything worth doing is difficult to do. And there's no easy way to get past fears except to face them. So I deliberately put myself in the spotlight. I deliberately put myself in situations, if I'm facing my fears, I deliberately put myself in situations where you can see me up close, or I might, having a conversation with you might make me really uncomfortable. So it might be that I'll make a plan that I'm going to, even though it's uncomfortable, I'm going to make small talk with that cashier. And in fact, I might even plan it so I can have interactions with several cashiers over the next half hour, and one after another I'm going to make some small talk, even though I get really uncomfortable with the idea that I'm facing my fears. And there's something powerful that happens when I face my fears. It might be that the telephone's really uncomfortable for me, so I might decide, okay, I'm going to make phone calls, one after the other after the other. You know, how much is milk, right? I might pause, I might in front of you because I might be afraid that you might judge me if I look nervous or uncertain. It's even possible that I've been doing that throughout our discussion today. Or it could be that I naturally am. I might make deliberate mistakes. Because on some level, you remember the disaster-making issue, I might think, it'd be awful if you judged me. So it'd be awful if I'd make a mistake. And so I might make mistakes on purpose. So I might deliberately, when I go talk to that cashier or whatever, I might deliberately mispronounce words. I might deliberately do other things imperfectly. I might deliberately stutter. Why? Because I'm so sick and tired of being caged in by this fear that's kept me from potentially completing my college education or having the kind of life that I want to live, that it's worth doing. It's worth doing these things that are awkward and uncomfortable. And it's the people who have become really fed up with their problem enough to cross that threshold that they're willing to suffer a little bit by facing fears. Those are the people who really get a big win. I might inconvenience others on purpose as well. That actually is one of the I won't even get into that. But sometimes it's funny to deliberately inconvenience other people. I mean, you're not trying to make them really suffer, but if you're going to deliberately slow somebody down for a second or two, if you have trouble with social anxiety, it's excruciating at first. Like if the light turns green, 1/1000.
Yeah, no.
If you suffer from social anxiety, your veins will be swelling. But because facing fears typically results in, by the end of my fear facing, if I stick with it for a long time, I get to be less afraid. So consequently, after I've done that to 40 cars, I'm less afraid. My anxiety drops, like that graph shows. I'm reducing safety behaviors, we talked about that. Terry, I said I'd talk about testing.
It's okay.
Same basic principles. I worry thoughts, I worry too much about whether I'm going to fail on this test or whether I'm going to do poorly. And so I want to do the same things. I want to change my thoughts. Is it really the end of the world if I get a bad grade on this particular test? Really? Maybe it's not. Maybe I even want to face my fears. Maybe I want to deliberately put the wrong answer on a couple of quizzes or in a couple of papers so I get less afraid of imperfection. So the key is noticing the problem. noticing the people who are trying to conceal that they have the problem, acknowledging it in yourself if you're the person who suffers, and then seeking good help. Thank you very much.